past year, Jerry Gunn's 7-year-old daughter, Leandra, has been in and out of ICU 7 times, but her care is 24/7. Dealing with it for the Gunns means Jerry is unable to work, and the emotional and financial strain has taken a toll.
It's hard. Simple as that. It's hard.
Now a potential added stress. The health region is considering a proposal to consolidate pediatric services in Regina. They would maintain a certain level of care at the general, but many children could be transferred to the intensive care unit in Saskatoon.
The first thing I thought of was, how am I going to do this? You know, you're 3 hours away in Saskatoon. Do I want to be 3 hours away when my child dies?
The Saskatchewan Union of Nurses is echoing their concerns. They want the health region to take its time in making this difficult decision and conduct a transparent consultation.
What has been the occupancy of those beds? What are the trends? How many patients have already been going to Saskatoon or elsewhere? All of that kind of information, I think, so that people feel that there has been a very thorough examination of all of the facts.
Another concern for families like the Gunns is the safety of their children on the long drive to Saskatoon on Saskatchewan winter highways. But the health region says that's already happening in some cases, and what they're trying to do is balance that with better specialty care offered in that city.
It comes down to your availability of resources, and if you look at the total population of the province, it's about 1.1 million roughly, and you look at other jurisdictions, it's usually around that size that can justify and attract the types of subspecialties required in pediatrics to be able to support.
Despite the hardships it would cause, it's looking more and more like local care may not be in Leandra's future. Raquel Fletcher, Global News.
A tragic update now on some news we brought you yesterday. In our story about the Regina Pediatric ICU possibly closing, we introduced you to the Gunn family. We've learned this morning 7-year-old Leandra Gunn passed away just an hour before we went to air. The Gunns wish to express their gratitude for the amazing staff at the Regina General Hospital and hope Leandra's story will continue to be a strong example of why the unit should stay open. On behalf of all the staff here at Global Regina, I'd like to offer our condolences for the Gunns' tragic loss. Police